Are you ready to get back on the road after an injury? Look no further. In this Return to Run program, I will guide you back on your running journey to reclaiming the roads again and returning to running stronger than ever before without having to worry about falling into the injury cycle again. If you are wondering, how do you get back into running after years? Or how do you start running after a long time away, whether it was due to an injury, illness, after giving birth, or crazy life circumstances? Then this training is for you. If you want to start running again and you are out of shape, or you want to enjoy running again, this return to running plan is for you. Get ready to discover proven techniques for recovering from injuries, preventing future setbacks, and building up your stamina. Whether you're a beginner or a seasoned runner or a medical provider who wants to help your patients get back to running, the tips and advice I will share with you today will help you or your patients bounce back to reach new heights in their running game. If you're ready to finally get back on the road consistently so you can get those mental clearing miles in without having to worry about your pain coming back or suffering a major setback, then follow along with my simple return to running program. My name is Dr. Dwayne Scotty. I'm a running physical therapist, coach, educator, and founder of Spark Healthy Runner. And my mission is to preserve the health and longevity of runners everywhere by allowing them to get stronger, run faster, and enjoy lifelong injury-free running. In today's training, I am going to cover who would benefit from a return to running program. How do I get back into running after years? When is a return to run program used? What is the return to running program after an injury? So go over the details. And then I'm going to talk about the 3 phases of a return to run program. And I know 7 to 9 out of every 10 runners listening to this right now at some point will get injured. And one of the most common reasons runners have a high reoccurrence rate of injuries is they fail to return to run appropriately. This either, they take too much time off, you run too fast, you do random runs based on feel, and there are simple strategies you can take to tolerate the demands of running again without feeling injured. Trying to get back into running is intimidating. And let's be honest, it's scary. I get it. I've been there before when I had my proximal hamstring tendinopathy injury, and I was told to stop running and to just stretch it. Later, I learned that was definitely not the best course of action. And for instance, like if you've ever wanted to develop a strong running body so you can stay healthy, to train for a running goal of yours, or you want to run faster and longer to conquer new distance goals, whether it's a half marathon or a marathon, without feeling pain. And if you don't have a structured plan for getting back into running, here's what's at stake. You are going to continue to try and run, feel some pain, and then take 2 to 3 days off of running to get it to quote unquote calm down. And then you try again and you just become frustrated that you can't run anymore. You will just think your body is not meant for running. You will feel like you are an injury prone runner. You will become frustrated and just take another month off and pray for the best. And hopefully, the next time you go and try to run, your pain's going to be gone. You guess instead of really following a specific distance and speed that you should be running each day. And you really wind up thinking you're getting too old for running, and your running keeps getting slower because you don't want your pain to come back. And that leads to complete frustration, constantly feeling overwhelmed with the amount of information out there. And I don't want that for you. We at Spark Healthy Runner want you to have a plan and how you can return to running in a safe and effective manner so you can get back to doing what you love and run for longevity. And this really is not a plan that most adult runners know about. And honestly, quite frankly, most medical practitioners and coaches are following either. And based upon my 20 years experience as a running physical therapist and coach, I've found that most healthcare providers have too conservative a plan, starting with walk run intervals of maybe 5 minutes of walking, then 1 minute of running. And they don't include, or they're missing, the principles of training, varying the amount of running that runners are used to each day, or the total volume. So, example, like the amount of miles. So, they're not varying the volume or the amount of miles in their return to run programs. And I've looked at many programs, and most run coaches, to be honest with you, have a plan that either doesn't utilize structured walk run intervals, which can be key in recovering from an injury, or they keep the walking intervals in for too long. So I've seen like many plans that are doing like 8 to 10 minutes of running, and then they follow it up with like 1 minute of walking. And at this point, honestly, your body doesn't require the walk run intervals in my clinical and coaching experience. So I am super, super excited to actually share with you this Spark Healthy Runner method, which is really built upon respecting tissue healing principles that I've learned as a physical therapist. And I've really integrated it with my run coaching training and principles of periodization, recovery, and structuring a run plan with shorter runs during the week and maintaining a long run within the weekly schedule. And as a running physical therapist and coach, I've given thousands of runners a plan for returning to running during an injury, after they were discharged from physical therapy and like done with their rehab, or following surgery. And my Spark Healthy Runner plan will work for you too. So whether you are struggling with IT band syndrome, plantar fasciitis, PHT, that proximal hamstring tendon pain I mentioned, shin splints, posterior tibial tendonitis, you're doing your post-op recovery from a meniscus surgery, ACL surgery, or a hip labral tear surgery, this training is going to be super helpful for you. All you need to do is literally listen in to the rest of this training. That's step one. Step two, download our Spark Healthy Runner Return to Running Blueprint. I outline everything that I'm going to be talking about here in visual form. I am a very visual learner, so I kind of map out the whole plan for you. And then the third step, I can't do it for you, honestly. You have to actually do the running plan that I structured out for you as outlined and implement the pain monitoring model that we will cover today and start feeling like your old self again, getting back to consistent runs, feeling healthy, and really back on the road, ready to start your training for your next running goal without having to worry about getting injured again. So make sure you download the Return to Running After Injury Blueprint. Just simply go to learn.sparkhealthyrunner.com/return to run. So back when I first started working with runners in the PT clinic, like we're talking 15, 20 years ago, I didn't know how to honestly have them get back into running. I remember telling my runners to just, once I got them kind of out of pain, right? They were feeling like they weren't in pain anymore. So I'm like, oh, they're healed from their injury. Let's test the waters, right? I'd say like go out and do 25% of what you would normally do, or I would like pull some random number out of the air. Honestly, I would say 10 minutes. Let's go out for a 10-minute run. Make sure you don't have pain. If you have pain, stop. And if you complete that 10-minute run and you didn't have any negative consequences, you didn't have any pain, then go ahead and try it again the next day. Like now listening to this advice, I'm like cringing because I hear this so often from so many of the clients that I work with, that they've been given advice like that. And I, honestly apologize to the patients that I've treated 15 to 20 years ago at the beginning of my career journey, who got that advice. But this is quite common in the medical community unless you are working with a running specific provider, which I always recommend. So if you are a dedicated runner like I am, and you just love getting out there consistently all year round, you have some big running goals, you want to get some medals, you want to like crush some races, then you definitely need to see a run specific provider. Highly, highly recommend it. Um, so I'm just honestly super excited to share what I've really been testing essentially in the lab, and the lab meaning all of the patients that I used to treat when I was, seeing clients one on one, and then really this pretty much got, almost like multiplied, or we got, the 10x version once I actually became a run coach and really implemented both the rehab principles with the coaching principles. So let's get into this content, guys. Who would benefit from a return to running program? So let's start there, right? Like, who's going to benefit from the system that I'm about to share with you? Number one, if you're currently injured and you have no red flags to not run, meaning you don't have a current fracture, or you may have a fracture. You don't have a bone stress injury. It's not a stress fracture. You don't have nerve pain, and you don't have like this severe pain and inflammation going on in a joint where you can hardly walk, right? It's like painful to walk. You're compensating for your walking. You definitely shouldn't be starting this return to run program. All right. But the majority of you who do have the most common running related injuries I mentioned, including runner's knee, IT band syndrome, plantar fasciitis, Achilles tendonitis, tendinopathy, then you guys are going to benefit from this. Two, after your rehab from an injury is done, and typically, whether your insurance visits ran out, your PT said you're discharged, you're good to go. I think you're going to continue to get better from this point forward. Just go out and run. Just try doing a couple runs. Just go easy, right? Like, just don't go out there and do anything too crazy, right? Don't go injure yourself again. I don't want to see you back in the clinic in a couple weeks, right? Like, if that's you, then this is for you. Three, following surgery. So meniscal surgeries, ACL, hip arthroscopy, even total hip replacements, if your surgeon said it's okay for you to get back to running. I've worked with many total hip patients who got back to running using the plan I'm going to talk about. Four, postpartum. You moms out there, you new moms, right? Like after giving birth, or even after your second child, third child, and you haven't gotten back to running yet, right? You've been going through many years of, the wonderful joys of expanding your family, and now you're ready to get back into running, and you've been cleared by your OB/GYN that you can get back into running, and you're not having any, medical issues, pelvic pain, all of that. We've done previous content on getting back to running after birth, but this return to run program will be for you. Also, fifth person this would be for is a long time period off of running. So you've taken greater than 2 months off of running. Then you're going to need to follow this structured plan that I'm going to be talking about. Or if you're really out of shape and you want to start running again, and it's been really long time, this is going to be for you. And those that have been maybe like peaking a little interest in running, and maybe you're like a consistent walker, right? You just love going out walking with your friends, chat it up, maybe do a lunchtime walk, maybe do the after work walk around the neighborhood, maybe you love walking your dog, right, on a daily basis, and then you see these people running and you're like, you know what, maybe I want to try this running thing. This training is for you. So those are like the 7 scenarios, which honestly encompasses a lot of people out there. And the one caveat to this is I want to make sure that you do have medical clearance for return to run after a major injury, a bone stress injury, and following surgery, or after giving birth. Like for those, you want to make sure that you do have medical clearance to start a return to run program. So now let's talk, what is the return to running program after an injury? So my Spark Healthy Runner method really contains 3 phases. Phase 1, this is the restore phase. And this phase can last anywhere between 4 to 6 weeks. And the goal of this phase is to allow the body to adapt to the demands of running again. So we're kind of allowing some stress to occur to your tissues, to your body, to your bones, tendons, muscles, ligaments, and then allowing appropriate recovery. So, what is this? This is structured run walk intervals that are varied each day of the week and progressive each week of the month. And this is where I see a lot of kind of people getting it wrong is it doesn't contain those elements. That is not varied each day and it's not progressive each week of the month. And all of the runs that you're going to be doing in phase 1 always start with a 10-minute walk before to allow full blood flow into the tissues, into your muscles, into the injured body part, let's say. And then you're really ready to start your running intervals. And then they always end with a cool down. This is really essential for kind of increasing the quote unquote time on your feet that we talk about so much in kind of the running community. Next, you're going to progress into phase 2, which is the rebuild phase. And this is going to last anywhere between 4 and 8 weeks. The goal here is to establish a strong running base, or what we call quote unquote base training. And what is this? This is running without structured walking intervals. This doesn't mean, though, you can't walk if you need to, or you feel like you're, you just need to walk, whether it is a conditioning element and your endurance is just not back and you're getting a little short of breath. The effort is getting a little too high. Your heart rate is starting to spike a little bit more because we want to keep all of your runs in this phase easy runs. These are all recovery runs in the easy zone. So we usually use the RPE scale, so rating of perceived exertion, anywhere between a 3 or 4. Some people use a 5. I really try to stay around 3 to 4 for my runners in terms of effort, meaning you're keeping it conversational pace. You can actually talk to someone as you are running. Now, remember, we are getting back into running. So if it is a little harder than you're used to at that pace, that is completely normal. If you're used to going for all of your runs at a 10-minute pace, 10:30 pace, 11-minute pace, and it's feeling harder than it used to feel, that's completely normal. You haven't run in a while. As you get back into consistent running, then that conditioning is going to improve. So have no fear. But that is the goal of this rebuild phase, phase 2. Lastly, we're really going to go into phase 3. And this is the retrain phase. And this is going to last anywhere from 4 to 8 weeks. And the goal is really to improve your running form and become more efficient as a runner. This is going to help decrease stress to the body part that was injured, or decrease stress to areas, problem areas. Maybe if you are returning from baby, right? Or it's just been a long time off and you haven't been injured. Really, what is this? This is adding in shorter bouts of faster running. And the first step of this is actually adding in what we call a form drill, or we call strides. And these are just short intervals in which you're getting leg turnover, improving running form, kind of training the brain to improve your running form using your run specific muscles, get increased leg turnover. And this may also include a little bit of faster pace, but for shorter intervals. And when I say faster pace, I'm not saying sprinting. I'm not even talking about for those that are used to training in training plans and doing like a tempo pace. I'm not talking about that. I'm talking about almost like a marathon pace or a half marathon pace for you marathoners out there, for shorter intervals, not like doing mile repeats, maybe that you would do in like marathon training, right? These are going to be shorter intervals, just getting the body used to adapting to faster running. Definitely not doing repeat hard workouts on the track, 400s, 800s, 1200s. That's not in phase 3. And the time of this return to run program that we're talking about can essentially vary. Notice how I gave you some parameters and I gave some wiggle room. Can vary between 12 weeks on the shortest end to 20 weeks. So we're talking like 3 to 5 months. This is important, meaning you shouldn't have a half marathon planned in 12 weeks and you're starting a return to run program, because then you're really looking for disaster and having a huge setback and going down the injury cycle. So if you're dedicating yourself to a return to run program, I really want you to set the mind right first and foremost and set appropriate goals and really double down on this phase, this training block. Your goal is to get back into running, do it in a healthy manner, get consistent, set some more process goals as opposed to outcome goals. Don't focus on pace. Don't look at how slow your runs are and think about what you used to do. Don't even go there. Your process goal is to get out the door consistently 3 to 4 days a week, do your strength training exercise to get your body stronger for running, and progress in a structured way that avoids the mind and the emotional feeling that you feel, whether it's like a really nice day outside and you just feel like running longer, or today you just don't feel like running, so you skip your run, right? Like those are the things that are going to prevent you from actually getting back to running and training for that half marathon or getting back into marathon training in a healthy manner. So during this time period, you got to set the mind right. And that's where we always talk about our 6 steps to growing as a runner. It always starts with mindset. For now, for where you are in your running journey, where you found this content, it's a matter of, okay, I'm going to look at this as my process goal and really embrace the process of gradually building back up, not being your own worst enemy and not reacting on emotion or feel and just doing whatever, you feel like doing that day. All right. And so the time period's going to vary depending upon your level of experience with previous running fitness. So for those that have run multiple marathons, they've trained for races before, you've done structured plans, you've worked with a coach, like you're most likely going to progress a little bit faster versus someone with minimal running experience. And maybe you've just been running for 6 months, a year, 2 years. It also depends upon the severity of your injury. So if you really did have a stress fracture, and even if you are a well-accomplished marathoner, right, then your return to run program is actually going to take a little bit longer because you are more at risk because you had a more severe injury versus someone who is suffering from runner's knee, right? That one is usually a pretty quick one that we're going to get back from. And then also, what was the duration of time away from running? The longer the time away from running, the longer your return to running program will actually be. All right. So now let's shift gears to when is a return to run program used? So this is like the prerequisites, essentially. So in order to start the return to run program, all of the following criteria must be met. Number one, you got to have medical clearance for your return to run. And this is the second time I'm mentioning it. It's so important. That's why I'm mentioning it twice. After a major injury, a bone stress injury, post-surgical, and postpartum. Two, you need to be able to dedicate 30 to 60 minutes of time to running and returning to this running that you love at least 3 times a week. So you got to be able to dedicate the time. You got to commit. 3, you got to have the proper mindset that you're ready and you're committed to returning to running. That's it. You're not setting a goal to run faster. You're not setting a goal to hit a new distance. You're committed right now to returning to running consistently. 4, pain between a 0 and a 4 out of 10 scale during walking and everyday activities. If you're having a pain of a 5, 6, 7, 8, 9, 10 during walking and everyday activities, you are not ready for this yet. So now let's talk about our pain monitoring model. And this is really utilizing our numerical pain rating scale, or we call it the NPRS, where 0 is no pain, 10 is the worst pain imaginable. Let's talk the first phase. And I think this is going to be helpful for you as you begin your return to running journey. Anywhere with pain, a 0 to a 2, I call this the safe zone. So this is like green. So if we use like color scheme, green is going to be go, right? Yellow is going to be a little caution. Red is going to be stop. So green, safe zone, anywhere from a 0 to a 2 out of 10 scale. And I want you to proceed with confidence that your body is ready. This is very common that most people get this wrong. They feel a twinge, they feel a 1 out of 10 pain, they even feel a 2 out of 10 pain, and they stop. They get fearful. Oh my God, my injury is going to come back. Let me take off 1 or 2 days, 3 days, 4 days. Let me try to run next week. No, I do not want you to do that. You are in the safe zone. Safe zone. All right. Following the progressive structured plan that I'm going to talk about, like you're going to be good. Now let's talk about the yellow zone. This is the acceptable zone. So this is if you're experiencing a pain rating between a 3 and a 4. And here I really want you to proceed with caution. I don't want you to be fearful, but also I don't want you to like get too like happy and just think like, "Oh, I'm like good to go because I can actually do this program and I'm going to do more because I'm kind of advanced." And Dwayne really doesn't know me and he doesn't know like my running accomplishments. I feel like I can jump to week 3 on day 2. Right? If you do that and you're in this yellow zone, you're definitely going to start getting some steps backwards. So you got to proceed with caution here. If you're in the red zone, you're at the high risk zone. So if you have a 5, a 6, a 7, an 8 at a 10 scale, you are not ready for return to run unless you are supervised by a medical professional. Have I helped runners who have had a 5, a 6, and even a 7 out of 10 pain with the return to running program? Modified, of course, personalized to them. Absolutely. But I would not say by listening to this training, if you're in that zone and you don't have someone that you can actually message on a daily basis, check in with, they're monitoring your symptoms as you go, monitoring the program to your specific needs, highly would not recommend whatsoever. All right. If you're in the red zone, you are not ready for this yet. Let's wait for your injury to get a little bit better down to the yellow zone. So how do I get back into running after years? If you're wondering, like, how do we do this? What are the guidelines and progressions through the program? So let's talk about a little bit more specifics with this pain monitoring model. And as you're going through the program, the pain is allowed to reach a 4 on the NPRS scale, except for familiar pain from a bone stress injury. So let's say you've had a tibial stress fracture, a femoral stress fracture. If you start feeling sharp pain that was like the pain that you had before you first got diagnosed with the injury, before you went non-weight bearing for 4 to 8 weeks, depending upon the level of the injury, the provider, then like that is not allowed to occur. Otherwise, anyone else with the injury, the pain is allowed to reach that 4. Because remember, we're in that yellow zone. Okay. That's important for you to know as you are going through this return to running program. Also, it's important to know that the pain after completion of the run is allowed to reach a 4 on the NPRS. Also, the pain the morning after the run should not exceed a 4 on the NPRS. And pain is not allowed to increase from week to week. So if you're starting with a 1, the following week, we talk about what you're going to be doing on week 2, it goes to a 2. The following week, it goes to a 3. So now your pain's increasing from week to week. That's not allowed. Okay. Pain in the yellow acceptable zone must decrease to the safe zone within 3 weeks of the program. So if you're in that yellow zone that we talked about and your pain is a 3 or 4 out of 10, then within 3 weeks, I expect you to now go into the safe zone or the green zone. If it doesn't, then you definitely need to take a step back and make some significant modifications. The things that you're going to be feeling that is totally, completely expected and normal is general muscle achiness, tiredness, your legs feel heavy, you might, report to your spouse, your partner, like, my legs just felt like cement blocks. Like, that is all totally expected and normal and will decrease from week to week. So if you're experiencing any of that, I do not want you to modify the return to run program. So now coming up next, I am going to share with you the exact running intervals that I program for all of the injured runners that I work with. But before I do that, if this training so far has been helpful for you and you've been getting value out of it, please hit the like button if you're watching on YouTube, and subscribe to the channel if this is your first interaction with me. And turn on notifications so you can stay updated on all future videos that will really help keep your running feeling strong so you can last long. This will allow me to help creating content just like this and allow us to help more runners so they can continue doing all the things they love and enjoy lifelong injury-free running without having to be told to stop running with their injury. It would mean the world to me if you can do that. Hit the like button, please, and thank you. So let's talk about the specifics now. How do we program this out? What does this look like? What are you going to be doing? This is like exciting. You're embarking on your return to running journey. And you're not just going to do random things that someone said, okay, run 5 minutes, run 10 minutes, like I used to, right? Like give my patients back in the day. So phase one, the restore phase I mentioned, this is going to last 4 to 6 weeks. Most of my clients, it's 4 weeks. Some, it's up to 6 weeks. So the goal here, remember, is to allow the body to adapt to the demands of running again, that stress recovery. And this is all I'm going to be sharing, like a bunch of numbers. So if you're listening to the podcast, the audio version, numbers are just going to like go over your head, especially like for me, because I'm not a numbers guy. My wife's the accountant. I need to like see things visually. So I'm a visual learner. So that's why I got the download. So you can actually look at the physical numbers. You can like screenshot it on your phone. You can like print it out, like post it on your wall. Like, I'm dedicated to return to running. Here's what I'm doing. I got my plan, right? What you're going to be doing is running 3 days or 4. If you're used to running, so let's say your prior level of function is running 5 to 6 days, and you've been doing that consistently for months, years, right? Like I have, then you're going to tolerate a 4-day plan. If you're not used to that, you're fairly new to running, right? Your last 6 months, a year, 2 years, you wound up suffering your first running injury. You didn't run for a while, and now you're returning to running. Then stick with a 3-day plan, because that's always going to ensure that you're never running back-to-back days. Again, if you're used to 5 or 6 day plan, you're going to most likely tolerate the 4-day plan. So what does this look like? Week 1, what we're going to do is first day of running. You're excited, get out the door. Yeah, let's do this. We got 10-minute walk. And then you're going to do a 6 by 1 minute run followed by 1 minute walk. So you run for a minute, you walk for a minute, repeat that cycle 6 times, and then you follow it up with a 10-minute walk. So essentially, when we look at the amount of time that you're actually running is 6 minutes, which sounds like nothing, right? 6 minutes, like running, like that's right. You used to go out for maybe like a 30-minute run, an hour run, 2-hour long runs, right? You're doing marathon training. It's like you're running 2.5 hours, maybe 3 hours. 6 minutes, that's nothing, right? However, the time on your feet is actually 32 minutes with all of the walking to start, to end, and then the walking in between. Day 2, on week 1, you're going to do the same exact interval. So we're doing 1 minute run, 1 minute walk, but now we're going to repeat 8 times. So now we've increased the amount of running to 8 minutes and the total time to 36 minutes. Day 3, week 1, you're going to do the same interval, 1 minute run, 1 minute walk. We're going to repeat 10 times. This is your long run day, right? Remember, guys, the definition of a long run is the longest run of your week. Yes, this is your long run. So even though it's only 10 minutes of running, your total time is 40 minutes. Hey, we're getting pretty like respectable here, right? For a long run. So that's your long run on week 1. And you're going to feel amazing. You're going to feel great. You're going to be like, wow, I actually ran 3 times this week. I actually got a long run. You know what? I was out there for a pretty good amount of time. I'm starting to feel like I'm getting in somewhat of a routine. Now, if you have an increase in pain with trying this 1 minute run, 1 minute walk, then what I recommend is that you go down to 30 seconds of running. I do find it very uncommon for a lot of the running injuries that I see and I work with that I ever need to only do 30 seconds of running, by the way. So, but I will put that out there. If for some reason the 1 minute of running and 1 minute of walking is just increasing your pain too much, you're getting out of the acceptable zone, then give it a try to do the 30 seconds of running. All right. And if you're on the 4-day plan, then what I do is I add in an extra short run. So I add in the 6 reps. So the 6 by 1 minute run, 1 minute walk. So you're going to wind up doing a 6, an 8, another 6, and then your long run, the 10 reps of that. Week 1 is done. So now week 2, let's say all that went well. Pain didn't increase. If anything, it might even decrease to your surprise. In week 2, what we're going to do is we're going to actually increase the run time. We're going to keep the walk time the same. So now the interval is going to be 2 minutes of run, 1 minute of walking. And then we're going to keep the same rep structure. So we're going to do on day 1, 6 by 2-minute run, 1 minute walk, always with a 10-minute walk to start, 10-minute walk to finish. So in that example, now you're up in week 2 to 12 minutes of running and 38 minutes, of total exercise. And then when you do your 8 by 2-minute run, 1-minute walk, you're up to 16 minutes of running, 44 minutes of exercise. And then your long run on week 2 is looking at 20 minutes of running and 50 minutes of being outside, enjoying nature, right? Getting out there. That's week 2. And then what I found super helpful at this point is before we start increasing your running duration, I actually like to decrease your walk duration. And I found that very successful. So in my clinical and coaching experience, I have found at this point, week 3, to switch to 2 minutes of running and 30 seconds of walking. And then we do the same structure. One day is 6 by 2 minutes run, 30-second walk. Another day is 8 by, and your long run day is going to be 10 reps of that. Week 4, now we just keep increasing the duration of running. So now we're going to do 3 minutes of running, 30 seconds walk. Week 5, we're going to do 4 minutes of run, 30-second walk. Week 6, finally, we get to a 5-minute run, 30-second walk. And that is kind of the slowest progression over 6 weeks in this phase 1 that I described to you. Some of you, based upon all the other variables on how long your injury was, how severe your injury was, and how you're really feeling early on. And if you're in the green zone, then you might be able to go from the 1 minute on, 1 minute off, right to a 2 minute on, 30-second walk. Right. So you might even be able to, quite frankly, do start with the 2 minute, 1 minute interval. So that's why I give you a range that really what I found is a 4 to 6 week range in this phase 1. And then by week 7, you're moving into phase 2. And remember, in phase 2, we're really focusing on building up your kind of rebuilding your body. And I think I mentioned all the kind of variables that I would modify in phase 1, but just in case I wasn't clear on this, if for some reason you really aren't seeing progress or you're just not comfortable progressing to the next phase, there's no rush. You can always repeat the previous week. And then you can always modify the number of repetitions of the intervals if needed. So you can kind of play around with those variables. So now let's talk phase 2. This is like the phase that everyone loves to get into, because this is really where we start to run without structured walking intervals. Now, I always tell my clients that this doesn't mean that you can't walk if you need to or you want to. So, you might need to walk because your conditioning really isn't there yet. Or you know what? You start feeling a little pain and you're like, I just feel like I need to walk here. That's totally fine. Like, there's nothing saying, like, okay, you go from structured run walk to you need to run 100% of the time. And if you don't run 100% of the time, you're a failure. No, not at all. All right. So I always explain that to my clients that at this point in time, you can take walking breaks as needed throughout your run, but you don't need the structured walk run intervals. And this is the sweet spot that I find it when you get to that 5 minutes of running and then the 30 seconds of walking, that your body is ready to progress to full blown running without the structured intervals. So now how quickly you can ramp up in phase two is really determined by how much time away from running you have taken. So let's take the best possible scenario that it's really been less than a week that you've been not running. So in this scenario, you essentially have not lost any running fitness whatsoever. And return to running at phase two is actually where you need to start. So if you found this training and you're like, I've only taken a week off, I had a little minor injury, I'm not even feeling any pain anymore. You can start right here at this phase two and just skip phase one. And what I would recommend to you is that you keep the same number of running days per week that you're used to. If you're used to and consistently have been doing a 5-day run plan, keep that the same. And you're just going to do 80% of the volume for the first week with easy running only. So no speed work, 80% of the volume. So, for example, let's say you're used to running 20 miles per week, then on this first week of getting back into running, you're going to start with 16 miles per week the first week back. Or let's say you are used to running 30 miles per week, then you're going to start with 24 miles per week that first week back. And if you don't have any increase in symptoms, then honestly, you can go back to 100% of your running volume the second week. So that's kind of the minor injury. Maybe you're just like playing it super cautious and found this training. Most of you are probably not in that bucket, to tell you the truth. But let's say it's been 2 to 4 weeks of you not running, and really this results in not a lot of running fitness lost whatsoever. We're very hopeful here, guys. So if you were like training and you were building a solid foundation and you were segueing that into half marathon training, and it's the beginning of the training cycle and you had this injury and you wound up being told, you went to a medical provider and they're like, stop running 4 weeks. So you didn't run for 4 weeks and now you've started return to running and you've actually followed phase one that I mentioned before, now you're in phase two, then this is a minor setback, honestly, in your training. So a month off is going to be a minor setback. And you can start phase two at 50% of the running volume in the first half that you were used to. All right. So if you're a 20-mile per week runner, let's use that example, and you took a month off, then the first you would follow the phase one that I mentioned, the run walk intervals. And then the first 2 weeks back in phase two, you are going to do 10 miles per week of straight running without the walking intervals. And then the next 2 weeks, you would increase to 15 miles per week and then get back to 20 miles per week in 1 month's time. Let's take the example. Let's say you're a 40-mile per week runner, like you're a pretty seasoned marathon runner, and you take a month off. Then the first, really, once you finish phase one, probably about 4 weeks, then you're going to start phase two. And the first 2 weeks back here of doing running without walking intervals would be at 20 miles per week. And then you would increase the next 2 weeks to 30 miles per week. and then really get back to your baseline and where you were previously at in 1 month's time. So in 4 weeks of phase 2, you're back up to 40 miles per week. And this is all easy running, by the way. No fast stuff, no speed work. And honestly, if you're in that camp, that scenario of 40 mile per week runner, I usually do it more gradual. Do like 20 miles per week the first week, 25 the next, 30, 35. So for that month, really, it's these kind of steps that you're taking. Now let's take probably, honestly, the majority of you listening to this right now are going to fall in this bucket, 4 to 8 weeks off of running because you were told you needed to go to like physical therapy 2 to 3 times a week for 6 to 8 weeks. And they told you like, no running right now until you have no pain. And then you're cleared to start return to run. Right. So it usually is 4 to 8 weeks, or you had a bone stress injury. And yes, it was definitely 4 to 8 weeks, 12 weeks, or even 16 weeks in certain cases. So now, you have lost some running fitness, but it's not all running fitness. So don't get like totally crazy on us here. It is like, Jack Daniels, the coach, he refers to this as like a 20% running fitness loss. And once you go through phase 1, when you get in phase 2 and you start running without walking intervals, I want you to return to running at 25 to 30% of the volume for the first third of this portion. So let's say you're a 40 mile per week runner again. You took 3 months off due to a stress fracture. 3 months is just easy math for me. Like I mentioned, I'm not a numbers guy because we're going to break this into thirds, right? So for the first third, you're going to do 25 to 30% of the volume. Let's say you had 3 months off due to a stress fracture. The first month of this phase is going to be 10 to 15 miles per week. So you're doing 25% to 30% of what you were used to doing per week. So now you're starting with 10 to 15 miles per week. And then the second month, you're going to really work in the range of 20 to 25 miles per week. And then the third month, the last third of this recovery, because you took 3 months off, is going to be in the 30 to 35 mile per week range before fully getting back to the baseline of 40 miles per week. Right? So that's going to really be a total of those 3 months that you're taking in this phase. So it's going to be a longer process. And then the last phase, which I'm going to describe fairly quickly here at this point, is phase 3, and that's where we retrain. It's going to be 4 to 8 weeks long. The goal is to improve running form and become more efficient as a runner. This is where we add in the shorter bouts of faster running. So the earliest you would ever add this, let's say it took you 2 to 4 weeks in phase 1, 4 weeks in phase 2. So now you're at like the third month, essentially, right? You're like 12 weeks in your return to running journey. That's the earliest that I would recommend adding in any strides, adding in any shorter intervals at tempo pace. And again, the time of this is going to vary depending upon your previous running fitness, experience with training, severity of injury, and the duration of time away from running. And then we go into like once you're in that phase 3 and you do that for, about 4, maybe 8 weeks, and then you're ready to actually officially get into race specific training and train for a fast 5K, train for that half marathon, train for that marathon. So just recapping what you all learned today is what or who would benefit most from this return to run program I mentioned. How do we get back into running after years? When is the return to running program used? So we talk about who is this for? What are the prerequisites that you have to meet? What is the return to running program after injury? Really detailed, right? The intervals that you should be programming out. And we talked about the 3 phases of this return to run program in depth. So by listening to this training, guys, you took step 1, right? Remember, step 2, get your download, get the freebie. I structure it out for you, get the visual so you know exactly what to do each day of the week and you know the proper progression. And then step three, you got to implement these principles into your comeback journey and start. If you do that, you're going to start feeling fresh. You're going to be less fatigued. You're going to start really tackling the demands that training gives us. And if you want personalization with your return to run program strategies or strength training for running, because we didn't even get to mention that, but strength training is a critical part about your return to run program. Definitely beyond the scope of this training, because then this would turn to like 2 hours and you definitely wouldn't listen to me for 2 hours. But luckily for you, I've done previous trainings on strength training for runners specifically. So you're going to have to catch that training. And if you want personalization, how to actually implement the strength training into your running, into your busy schedule. You want clarity, you want focus, you want accountability and support because you've tried it in the past and you never held your feet to the fire. You weren't consistent, you were too random. So you want that accountability support. That's exactly what we specialize in with our Spark Healthy Runner coaching program. We guide you back on the road doing what you love without having a setback. So let us take away the guesswork and support you along this process, getting back on the road. We act as your guide in mastering the 6 key steps in your running journey. 1 is mindset, 2 is strength training, 3 is a structured run plan. Today, we talked about the return to run and how to structure out that walk run intervals. 4 is your nutrition for running, which is super important. 5 is the recovery. So we provide you all the recovery strategies. And then 6 is when you're ready to get back into racing, your race strategy. And when you get the structure to execute those 6 key steps in your running journey, you'll not only feel more confident in getting stronger and faster, you'll stay healthy and enjoy the process of running again, and then eventually crush some races along the way in your journey. So, like a well built home will require little maintenance and bring you a lifetime of memories for you and your family, so will your running journey. Because I use the analogy that our 6 steps to growing as a runner is just like 6 steps to building a house. So, you have to get that analogy in my training on how to grow as a runner. Learn more about our Spark Healthy Runner signature coaching program and schedule a call with me by going to learn.sparkhealthyrunner.com/coaching. Lastly, if you learned something today, guys, and this was helpful, and this was beyond anything you've searched online, what your medical practitioners have told you, and people in the running community have just said, go do walk run or just follow a specific method and you'll be fine. If you wouldn't mind copying this link, sharing it with a running friend who can use it, share it with someone you know who is injured, share it with someone who's looking to get back into running after taking years off of running or months off of running. I want our running community to enjoy lifelong injury-free running. And the only way that we can do that is by having runners like you who are lifelong learners like me, share this information with others so we can break the cycle and the misconceptions about running injuries within our medical community, and that runners don't need to stop running when they have an injury. And I really appreciate it. Thank you in advance for sharing this content and our mission in with runners who are struggling to get back to running after a long time off. As always, let's maintain a strong mind, a strong body, and let's just keep on running. Until next time.